The World Health Organization has declared an outbreak of Ebola in the Democratic Republic of Congo. This new outbreak is called Bundibugyo virus, and I think I've caught it too. There has been hundreds of suspected cases and 80 deaths. Furthermore, in this region, there is a conflict between tribes over resources, making the situation much worse. So, what should we be doing in Ireland? Well, what happens if someone gets Ebola virus in Ireland? They go to the Mater Hospital. That's a large hospital in the centre of the city centre. It's in the most densely populated part of our country. It's almost like our politicians want us to be sick, because the people with Ebola are going to be in the same building with elderly people with cancer or pregnant women with various injuries. What I'm suggesting, if you want to protect ourselves from the Ebola outbreak, is close the borders, build more hospitals. We need to restrict migration from people from Africa, particularly that part of Africa, Congo, Uganda, and Sudan, to name a few, or just restrict all of Africa. We need to build hospitals that are specifically qualified to take care of these kind of infections, these highly dangerous infectious virus. If you go to the Mater, people there are working 15-hour shifts. They are overworked and underpaid. It is very easy for them to slip up, and a nurse or security staff or cleaning staff, they're going in between the different wards, and Dr. Marcus de Bruin has already made it publicly known how the COVID virus spread among elderly people under state care, because they don't. Irish healthcare system is just really, really bad. So we need to restrict migration from Africa, double our healthcare staff, pay people better, build new hospitals specifically for infectious diseases. This is what other Asian countries do. Other Asian countries where less people died of COVID, they had more hospital beds, they had more hospitals per people than we do. And that is why Ireland has such high excess deaths since COVID. Our healthcare system is now worse since all those terrible policies that came in. And anybody any Irish person who's struggling to pay the bills and they don't have enough money to live, be they either unemployed or underemployed, they should be encouraged to get jobs in the healthcare sector. So people have it in their mind that if they work in the healthcare sector, they'll have a good paid job and be able to buy property and have access to healthcare. So yeah, restrict migration from Africa, build more hospitals.